Welcome to today's video about symptoms of heart attack. Have you ever wondered how someone could suffer a heart attack and not even realize it? What if the most dangerous warning signs aren't even painful? Here's a shocking truth. Over 18 million people die each year from heart disease, making it the #1 cause of death worldwide, according to the World Health Organization. Yet millions more walk around every day, completely unaware that their hearts are in serious trouble. Why? Because the symptoms aren't always what you'd expect. We've been trained to think it's all about crushing chest pain, but research shows that many heart attacks present with mild, strange, or even no symptoms at all. And that's what makes them so deadly. Now here's the twist. In one major study, 45% of all heart attacks were classified as silent. That means nearly half of these life-threatening events happen without the classic signs. Scary, right? But here's the good news. Knowledge is power. Today, we're revealing 14 proven, research-backed symptoms of a heart attack, including the ones almost no one talks about. And the symptom we cover at number 14? It's subtle, sneaky, and could save your life or someone you love. Before we dive in, let us know in the comments. Where are you watching from? Your story could help others recognize the signs early. Don't forget to like this video and subscribe, because staying informed could be the most important decision you make today. Let's take charge of our health. Together. Ready? Let's jump into the signs your heart might be sending you before it's too late. Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified. References are linked in the description. All right, let's break down the most important symptoms, starting right at number 1. Chest pain or discomfort. Chest discomfort isn't just a minor annoyance, it can be a critical warning sign. Many individuals describe it as a heavy pressure, squeezing, or burning sensation right in the center of the chest. This feeling often builds up gradually and can persist for more than 20 minutes, sometimes radiating to the left shoulder, neck, or jaw. In a study involving 331 patients with acute myocardial infarction, 93.1% reported chest pain as their primary complaint. Notably, 90% of these patients experienced pain lasting over 20 minutes, and 38.4% had pain localized to the precordial-like central chest area. These findings underscore the importance of recognizing prolonged central chest pain as a potential indicator of a heart attack. It's crucial to pay attention to these symptoms. If you or someone else experiences such chest discomfort, especially if it's persistent and radiates to other areas like the shoulder or jaw, seek medical attention immediately. Early intervention can be life-saving. Next, number 2. Shortness of breath. Imagine walking up a flight of stairs and suddenly feeling like you've run a marathon. This overwhelming breathlessness, especially if it's new or worsening, can be a red flag for your heart. When the heart's blood supply is blocked during a heart attack, it struggles to pump effectively. This inefficiency means less oxygen-rich blood reaches your lungs and body, making even simple tasks feel exhausting. Research has shown that shortness of breath is a significant indicator of heart issues. A study published in the European Heart Journal, Acute Cardiovascular Care, found that 1 in 4 heart attack patients experienced atypical symptoms like breathing difficulties. Alarmingly, these patients were less likely to receive emergency help and had higher mortality rates within 30 days compared to those with chest pain. It's crucial to recognize that feeling out of breath during minimal activity isn't just about aging or being out of shape. It could be your heart signaling distress. If you notice such changes, especially if they're sudden or unexplained, It's essential to consult a healthcare professional promptly. Next, number 3. Nausea or vomiting. Feeling queasy or throwing up isn't always about something you ate. Sometimes it's your heart trying to tell you something's wrong. During a heart attack, when blood flow to the heart is blocked, the body reacts in various ways. One reaction involves the vagus nerve, which connects the brain to the heart and digestive system. When the heart is under stress, this nerve can become overstimulated, leading to sensations of nausea or causing vomiting. Research supports this connection. A study published in the American Journal of Cardiology found that patients experiencing nausea or vomiting during a heart attack were more likely to have larger areas of heart damage. Specifically, 78% of patients with significant heart muscle injury reported these symptoms, compared to 55% overall. It's crucial to recognize that nausea or vomiting, especially when accompanied by other symptoms like chest discomfort or shortness of breath, could indicate a heart attack. If you or someone else experiences these signs, seek medical attention immediately. Next, number 4. Sweating. Breaking into a cold sweat while at rest, especially if you're not anxious or overheated, can be a red flag for a heart attack. This type of sweating, known as diaphoresis, occurs when the heart struggles to pump blood effectively, triggering the body's stress response. The sympathetic nervous system kicks in, releasing adrenaline that activates sweat glands, even without physical exertion. Imagine sitting calmly and suddenly feeling drenched in sweat. It's not just uncomfortable. It's your body's alarm system signaling that something's wrong. Studies have shown that such unexplained sweating can precede other heart attack symptoms or even be the sole indicator. For instance, research published in the Journal of the American College of Cardiology, 2021, highlights that profuse sweating is often reported by patients experiencing cardiac events. This isn't about sweating during a workout or on a hot day. It's about sudden, excessive perspiration without a clear cause. If you experience this, especially alongside other symptoms like chest discomfort or shortness of breath, it's crucial to seek medical attention immediately. Your body communicates in various ways. Don't ignore its signals. Unexplained sweating could be more than just an inconvenience. It might be a life-saving warning. Next, number 5. Lightheadedness or dizziness. Feeling unsteady or as if the room is spinning can be unsettling. This sensation often arises when your brain isn't receiving enough oxygen-rich blood, a situation that can occur during a heart attack. The heart's reduced pumping efficiency leads to decreased blood flow to the brain, resulting in lightheadedness or dizziness. This symptom is more than just a fleeting discomfort. It's a critical warning sign. A study published in the European Society of Cardiology in 2023 found that individuals who recognized early symptoms like dizziness sought medical attention faster, significantly improving their survival rates. The research emphasized that timely recognition of such symptoms could reduce in-hospital mortality from 6.7% to 1.5%. It's important to note that dizziness can be accompanied by other symptoms such as chest discomfort, shortness of breath, or nausea. These combinations can indicate a heart attack, especially in women, who may experience less typical symptoms. If you experience sudden dizziness, particularly alongside other symptoms, it's crucial to seek immediate medical attention. Early intervention can be life-saving. Next, number 6. Fatigue. Feeling unusually drained or worn out, especially when it's not tied to physical activity, might seem harmless. However, this kind of persistent tiredness can be an early warning sign of a heart attack. Research indicates that many individuals, particularly women, experience significant fatigue weeks before a cardiac event, often without the classic chest pain. A study published in Circulation revealed that 70% of women reported unusual fatigue in the month leading up to their heart attacks. This fatigue was described as profound and not relieved by rest. Such symptoms are frequently overlooked or misattributed to stress or aging, delaying critical medical attention. If you or someone you know is experiencing unexplained, persistent fatigue, it's essential to consult a healthcare professional. Recognizing and addressing this symptom early can be vital in preventing serious cardiac events. Next, number 7. Heart palpitations. Feeling your heart race or flutter unexpectedly can be unsettling. While often harmless, these sensations, known as palpitations, can sometimes signal a more serious issue, like a heart attack. When the heart's blood supply is compromised, it can trigger abnormal rhythms. These arrhythmias may manifest as palpitations, indicating that the heart is under stress. Notably, a 2023 study published in Cureus found that 42% of individuals who experienced a heart attack reported palpitations in the month leading up to the event. This suggests that palpitations can be an early warning sign of a heart attack. It's important to pay attention to these sensations, especially if they're new or occur alongside other symptoms like chest discomfort or shortness of breath. While palpitations alone don't confirm a heart attack, they shouldn't be dismissed, particularly if you have risk factors such as high blood pressure, diabetes, or a family history of heart disease. If you experience persistent or concerning palpitations, it's advisable to consult a healthcare professional. Early evaluation can help determine the cause and, if necessary, initiate treatment to prevent more serious complications. Next, number 8. Indigestion or heartburn. Many people associate chest pain with heart attacks, but sometimes the warning signs are more subtle. For instance, a burning sensation in the chest or discomfort after eating, often dismissed as indigestion, can actually be early indicators of a heart issue. Research has shown that such symptoms are not uncommon among heart attack patients. A study published in Circulation found that 39.4% of women reported indigestion as a prodromal symptom before experiencing an acute myocardial infarction. Interestingly, only 29.7% reported chest discomfort, highlighting that indigestion can sometimes be a more prominent early sign than the classic chest pain. This overlap between gastrointestinal and cardiac symptoms can lead to misinterpretation. In some cases, individuals may attribute their discomfort to acid reflux or heartburn, delaying critical medical attention. It's essential to recognize that if such symptoms are new, intense, or accompanied by other signs like shortness of breath or fatigue, they warrant immediate evaluation. Understanding these nuances can be life-saving. If you or someone you know experiences unexplained indigestion, especially if it's persistent or unusual, it's crucial to consult a healthcare professional promptly. Next, number 9. Anxiety. Experiencing a sudden, intense feeling that something catastrophic is about to happen can be unsettling. This sensation, often described as a sense of impending doom, isn't just a figment of imagination. It can be a real symptom of a heart attack. When the heart is under severe stress, such as during a heart attack, the body releases stress hormones like adrenaline. This hormonal surge can lead to heightened anxiety and that overwhelming feeling of dread. Interestingly, research has shown that this symptom is more prevalent among women. A study published in the journal Circulation noted that 35% of women reported experiencing a fear of death during the acute phase of a heart attack, compared to 20% of men. It's crucial to recognize that while feelings of anxiety can stem from various causes, when combined with other symptoms like chest discomfort, shortness of breath, or nausea, they shouldn't be ignored. Trusting your instincts and seeking immediate medical attention can make all the difference. Remember, your body has ways of signaling distress. It's essential to listen and act promptly. Next, number 10. Back or shoulder pain. You might not expect it, but discomfort in your back or shoulder can sometimes signal a heart attack. This isn't about muscle strain from lifting something heavy. It's a deeper, more persistent pain that doesn't improve with rest or typical remedies. This type of pain is known as referred pain, where the brain misinterprets signals from the heart, causing you to feel pain in areas like the back or shoulder instead of the chest. It's a phenomenon that can make recognizing a heart attack more challenging. In fact, a study published in the European Cardiology Review in 2013 found that women often experience heart attack symptoms differently, with back and shoulder pain being more common and sometimes occurring without the classic chest pain. This highlights the importance of paying attention to unusual discomforts, especially if you have risk factors for heart disease. If you experience unexplained back or shoulder pain, particularly if it's accompanied by other symptoms like shortness of breath, nausea, or lightheadedness, it's crucial to seek medical attention immediately. Early intervention can be life-saving. Remember, your body communicates in various ways. Don't ignore persistent or unusual pains. They could be more serious than they seem. Next, number 11. Jaw pain. Jaw discomfort isn't always about dental issues. Sometimes, it's your body's way of signaling a heart problem. This happens because the nerves that carry pain signals from the heart and jaw share similar pathways. When the heart is in distress, like during a heart attack, the brain can misinterpret the pain's origin, leading to what's called referred pain in the jaw. This type of pain often feels like a dull ache or pressure. It might come on suddenly or gradually, and it doesn't always go away with rest. Interestingly, women are more likely to experience jaw pain during a heart attack than men. This difference can make it harder to recognize the signs, especially if chest pain isn't present. A recent study published in the Cureus in 2023 found that 26% of women reported jaw pain as a symptom during a heart attack, compared to 9% of men. This highlights the importance of paying attention to such atypical symptoms, especially in women. If you ever feel unexplained jaw pain, particularly on the left side, and it's accompanied by other symptoms like shortness of breath or nausea, it's crucial to seek medical attention immediately. It's better to be cautious, as timely treatment can be life-saving. Next, number 12. Upper abdominal pain. Pain in the upper abdomen can sometimes signal a heart attack, especially when it feels like pressure or tightness. This discomfort is often mistaken for indigestion or heartburn, leading many to overlook a serious cardiac issue. The reason lies in how our bodies process pain. The nerves that serve the heart and the upper abdomen are closely connected. So, when the heart is in distress, the brain might interpret the pain as coming from the stomach area. This symptom is more common in women, older adults, and individuals with diabetes. They may experience upper abdominal pain during a heart attack without the classic chest pain. A study published in the American Journal of Cardiology found that women are more likely than men to present with non-chest pain symptoms, such as abdominal discomfort, during a heart attack. This can lead to delays in seeking treatment, increasing the risk of complications. If you ever feel unexplained pressure or pain in your upper abdomen, especially if it's accompanied by nausea, sweating, or shortness of breath, it's crucial to seek medical attention immediately. Don't dismiss it as just a stomach issue. It could be your heart sending out a distress signal. Next, number 13. Fainting or sudden loss of consciousness. Fainting, or syncope, can sometimes be an early warning sign of a heart attack. This occurs when the heart's ability to pump blood is compromised, leading to reduced oxygen supply to the brain and a sudden loss of consciousness. One primary cause is arrhythmia, where the heart beats too fast, too slow, or irregularly. Such irregular rhythms can prevent the heart from maintaining adequate blood pressure, resulting in fainting episodes. Conditions like ventricular tachycardia or complete heart block are examples where this can happen. In some cases, fainting might be the only noticeable symptom of a serious heart issue. Structural problems in the heart, such as aortic stenosis, narrowing of the aortic valve, can also lead to fainting. This is because the narrowed valve restricts blood flow, especially during physical activity, causing a drop in blood pressure and subsequent loss of consciousness. A recent study published in the Journal of Arrhythmia, 2017, highlighted that individuals experiencing unexplained fainting episodes had a higher risk of underlying cardiac conditions, including heart attacks. The study emphasized the importance of thorough cardiovascular evaluations in such cases. If you've experienced unexplained fainting, it's crucial to consult a healthcare professional. Early detection and management of potential heart issues can be life-saving. Next, number 14. No symptoms at all. You might be surprised to learn that it's possible to have a heart attack without any noticeable symptoms. These are known as silent heart attacks, and they can be just as dangerous as those with obvious signs. In fact, research indicates that about 1 in 5 heart attacks are silent, meaning the individual isn't aware they've experienced one. This lack of awareness can lead to delayed treatment and increased risk of complications. A recent study published in the Journal of the American College of Cardiology found that measuring troponin levels, a protein released when the heart muscle is damaged, even within the normal range, can help identify individuals at risk of silent heart damage. By incorporating troponin measurements into existing risk assessment models, doctors can more accurately predict a patient's 10-year risk of cardiovascular events, especially in those currently deemed at intermediate risk. These findings underscore the importance of regular health checkups and being proactive about heart health, even in the absence of symptoms. And that's it for today's video on the 14 symptoms of a heart attack you should never ignore. If even one of these signs sounded familiar, take it seriously. Awareness can truly save lives. If this video helped you understand your heart better, type "helpful" in the comments below. It not only lets us know we're making a difference, but it also motivates us to keep creating more content that empowers and educates you. Don't forget to like, subscribe, and turn on notifications so you never miss future health tips that could protect you and your loved ones. Thank you for spending your time with us today. Take care of your heart, because it's the engine of your life. Until next time, stay healthy, stay informed, and we'll see you in the next one.